Hello, everyone, and welcome to another Making Physics Easy webinar. So today's topic is the fundamentals of magnetic resonance imaging. And I think in all the sessions that I've done over the last year, this is one of the most requested topics, and understandably so, because the physics of magnetic resonance imaging is a little complicated to understand in the beginning. So before I dive into the topic, I'll introduce this webinar series as well as myself. So this webinar series is called Making Physics Easy, and it's for radiologists who are sitting their FRCR Part 1 physics exam. So what it consists of are video lectures as well as MCQ sessions in the style of the exam. And they go through the physics curriculum, the FRCR physics curriculum in a lot of detail. And we're trying to cover all the topics in the curriculum in this series. So while you're revising for your exam by studying from textbooks, as well as other video lectures and MCQ banks, we're hoping that this will be a supplement to your preparation. So my name is Joanna Koshi. I have a BSc in physics and an MSc in nanoscience, and I'm also part of the faculty at Revised Radiology. So together with Dr. Koshi Jacob and with the advice and help of other consultants and trainees, we are creating this physics course, which is designed specifically for radiologists who are taking their physics exam. And the reason is that radiologists are often quite out of touch with their physics. It's also the part of the exam which has a very high fail rate. So we realized that this was an area where people would appreciate a little extra help. So before I get started with the session today, I'll just let you know how this session is conducted. So I'll be going through a presentation I prepared of slides on the fundamentals of magnetic resonance imaging. So there's around 50 slides in the presentation, and it should take us 1 hour to finish. So during the presentation, if you have any questions, you can put those in the chat box, and I will look at those and try to answer them as we go along. So I'll be explaining the concepts in detail, but this is also for the people who are on the call to understand the concepts thoroughly. So if you have a question, you can put it in the chat box, and I'll be happy to stop and answer that in some more detail. If it's not possible at the time, I'll stay back a little longer after the session if you have a question that comes up during the webinar. So yeah, the last thing I want to mention is that this session is being recorded. So if you don't want to appear on the recording, all you have to do is keep your mic off and your video off, and you won't appear on the recording at all. And if you have a physics or combined revised radiology subscription, this webinar will be available for you to watch later on. Okay, so that's all I wanted to say before the webinar starts, and I'll jump right into the topics for today. So as I've already mentioned, we're going to be looking at the fundamentals of magnetic resonance imaging in the webinar today. And specifically, we'll spend a little time in the beginning looking at why do we choose this imaging modality? Why MRI when compared to CT or ultrasound or radionuclide imaging? So some of the advantages and disadvantages of this modality. The other thing that we'll be looking at in the webinar today is the fundamentals of the physics of magnetic resonance imaging. So what that means is we'll be looking at nuclear magnetic resonance in detail, and we'll specifically be trying to understand the relaxation times T1, T2, and T2 star. So those are the topics we'll be covering in today's webinar. So first, let's look at what are the advantages of magnetic resonance imaging, and why do we choose magnetic resonance imaging over other imaging modalities in certain situations. So first of all, it's a non-invasive technique. So we do sometimes administer contrast mediums in MR imaging, but mostly it's a non-invasive technique. Nothing is going into the patient's body. It's non-destructive, and the radiation involved is non-ionizing. So as we know, the biological damage which comes from radiation happens when ionization takes place in the body. And the classic example of an ionizing radiation is X-ray. So the radiation involved in MRI is non-ionizing. So that's a plus for us because it's not causing biological damage to the patient's body. So a few more reasons of why we choose MRI. So the basis on which we evaluate MRI as opposed to other imaging modalities is based on what parameter are we using to form these images. So we know when we're looking at X-ray images, what we're really seeing on the screen comes from the different ways in which tissues attenuate the X-rays. And the way that we measure that is using someone that's known as the linear attenuation coefficient. So our X-ray images, the contrast that we get is based on the difference in the way the tissues attenuate. Does bone attenuate more? Does soft tissue attenuate more? Does fat attenuate the X-ray beam more? That's fun. That's the basis of the imaging. In MRI, we're looking at a completely different phenomenon. We're looking at the relaxation times of the protons in different types of tissue. And so because we're looking at a completely different parameter, this method of imaging will give us much better contrast in certain situations. For example, MRI gives us superior soft tissue contrast as opposed to CT and X-ray. And the reason for this is that the relaxation time factor is different, is greater. The gap between the two is greater in MRI when we're looking at relaxation times versus when we're looking at the linear attenuation coefficient. So that's one reason why we will choose MRI for some kinds of studies. Another thing to think about is in X-ray imaging, we are really looking at how much is the radiation being blocked by the tissue. So then the aspect that we'll be considering is the physical density, whereas in MR, one of the main aspects is the physical density, whereas in MRI, we are looking at nuclear magnetic resonance, which depends on the number of protons, which depends on the number of mobile hydrogen nuclei. And we'll explain all these terms in detail later on. But essentially, what we need to understand here is that it gives us a different way of looking at the body, which can give us more legible images in certain situations. Another important factor of MRI is that in many types of examinations, there's no need to administer a contrast agent. So that's less invasive for the patient. There's less chance of allergic reactions or other kind of problems that arise from the contrast agent itself. So another advantage of MRI is that you can get multiple plane imaging without repositioning the patient. You can get precise tissue characterization and advanced visualization techniques. And some of the examples I've given here are diffusion weighted imaging, spectroscopy, and functional MRI. The other advantage of MRI is because we're using this phenomenon of nuclear magnetic resonance to create the images, we can create images which are based on a very wide array of clinical parameters. So we can compare tissues on the basis of their T1, on the basis of their T2, their proton density, T2 star, and on the basis of this, we can look at a lot of different things. So we can look at the blood flow in, I've written blow flood, but that should be blood flow in arteries and veins, the perfusion of blood through organs, molecular diffusion of water in tissue, blood oxygenation, and numerous metabolites. So it's a very diverse form of imaging, which gives us a lot of tools for trying to see what's going on in the patient's body. So those are the reasons why we might choose MRI in certain situations. Now let's look at what might be the disadvantages of MRI. So the MRI examination can take a long time. And when an examination takes a long time, we know that's a problem because the patient can only sit still for a certain period of time. So thanks to them moving, there can be motion artifacts which come in place. There may be contraindications which arise from, for example, implants in the patient's body or metal things in the patient's body, which cause artifacts to appear in the image, cause the image to not reflect the reality of the patient's body. It's costly. The equipment is very specialized. It's noisy. It's claustrophobic for the patient. And for the radiologist and other people who interact with the images, it can be quite hard to understand the concepts involved in MRI, because we're now dealing with very complex phenomena, which are particles. So we have to bring in concepts from quantum mechanics, from electromagnetism, and all of that is quite difficult for the radiologist to have a working knowledge. And obviously, in some cases, MRI is not the ideal examination, and other types of imaging need to be used. Okay, so we've just had a brief look at why we like MRI as an imaging modality. We've seen it doesn't use ionizing radiation. So what this means is you can expose the patient to radiation without being worried of cancer risks and other things like that. We've also seen that it's non-invasive in many cases, and it's also gives us high contrast in certain examinations, and it's also a very diverse and versatile imaging modality, and we're able to look at a number of different clinical parameters to get the information we need about what's happening in the patient's body. So in the next section of the webinar, we'll talk about what happens during the examination, and specifically we'll be trying to understand nuclear magnetic resonance. Okay, so I've got a picture on the left-hand side of the MRI setup, and we're looking at a really broad overview of how it works. So very broadly speaking, a magnetic field is applied to the patient's body, and a radio frequency pulse is applied. So we know what a magnetic field is. The Earth has a magnetic field. It's basically something in which magnets will react. So a magnetic field is something that makes magnets react in different ways. We are in magnetic fields all the time. We're in a magnetic field right now, which is the Earth's magnetic field. There's also radio frequency pulses which are applied. So what is a radio frequency pulse? It's a type of electromagnetic radiation which has a specific frequency that falls in the radio frequency range. And it's called a pulse because we don't apply it continuously. We apply it for a short period of time. So we've got the patient in the scanner. We've applied this magnetic field. We've applied this pulse or multiple pulses for a short period of time. And then in return, we receive a radio frequency pulse, which the computer will take. So we're applying a radio frequency pulse, and we're also receiving a radio frequency pulse, which is emitted by the patient. And then the computer is going to take that pulse, turn it into bits, and then finally reconstruct those bits into an image, which you, the radiologist, will look at and to form your diagnosis. Okay, so that's the really broad macro view of what's happening. Now we need to get into the physics of what's happening with the particles involved. And so in the beginning, when we're discussing these concepts, we'll need to get reacquainted with some physics concepts. So I'll take you through those. And once we've got a language and a vocabulary in which we can discuss this, we'll continue looking at what this means. So first of all, if you remember your high school physics, you'll remember that there's H and B fields. And this is a little slightly advanced concept. So I'll just touch on it briefly. Essentially, when the external magnetic field is applied, H is the actual magnetic field which occurs in the patient. So the B field is the field in which the patient is placed, and H is the magnetic field which is actually existing inside the patient. And you might ask the question, why are these fields not the same? And the answer to that comes from the other terms in this equation, which includes the mu and the m. So essentially, the mu and the m are things which happen in the patient's body, interactions which happen with the external magnetic field, and these interact in such a way that in some cases, the magnetic field within the object is not the same as the magnetic field that the object is placed in. So that's what this equation is expressing. Now, when we're discussing MRI, you'll very rarely hear this term H talked about, even though, so we're trying to discuss the magnetic field in the patient's body. So we should be using the term H. However, most commonly, you'll only hear discussions of the term B. B is the external magnetic field that's applied to the patient. And the reason, Oh, I'm so sorry. There's just been a little noise. So I'll just, yeah, just mute yourself. That would be great. And if everybody could just check that they're muted, that would be perfect. Okay. Thank you so much. All right. Yeah. So, so what is the reason that we should be talking about H, but instead we're talking about B? The reason is that for the human body, B and H are nearly identical. And this is because the magnetic permeability is close to 1 for the human body, and the magnetization is very close to 0. So basically, if you put mu is equal to 1 and m is equal to 0, you'll get H is equal to B. So when we're discussing MRI, we are talking about the magnetic field within the patient's body. However, we'll be using the term B instead of the term H. So that's the first little piece of vocabulary that we're adding to our dictionary so that we can discuss these concepts. Now let's move on to understanding nuclear magnetic resonance. So what is the basic thing of nuclear magnetic resonance? Nuclear magnetic resonance is a dance that is happening because of this magnetic field, and the dancers in the dance are the protons. So let's touch on what a proton is quickly. The hydrogen nucleus has a single proton in its center. What do we need to know about protons? They have mass, they have charge, and they have spin. So when we're talking about protons, when we're discussing MRI, what we're talking about are essentially hydrogen nuclei. Yeah, so these protons are positively charged. They have a certain mass, and they also have something called spin, which means that you can think of these protons as being tiny tops in your body that are spinning continuously, just like the Earth is rotating on its axis. So because these protons are charged objects, they have electric charge, and because they're continuously rotating, they behave like tiny magnets. So if you can think back to all the magnets you've interacted with in your life, the magnet on your fridge or some magnetic toy that you played with at some point, the proton in your body is a tiny, tiny magnet. Yeah, and these protons are present in bodily fluids, in water-based tissues, and in fat-based tissues. So yeah, so you might ask, we're talking about protons here and they're spinning. So why is it that we're only discussing hydrogen here? Because we know that there's many types of atoms in our body, and they all have protons in them. So there's a few concepts to be familiar with. The first is the hydrogen atom has an odd number of protons. So protons with nuclei which have an even number of protons, that is 2, 4, 6, 8, 10, etc., they don't behave like magnets, because when they're spinning, they sort of cancel each other out. So there's no net behavior of a magnet that comes out. So immediately all the nuclei in the body which have an even number of protons are not relevant for nuclear magnetic resonance. There's also other nuclei present in the body with an odd number of protons. An example is on the left-hand side, phosphorus. However, besides hydrogen, the number of nuclei with odd protons are very, very small. Hydrogen nuclei dominate in the body to a large extent. So in terms of nuclear magnetic resonance, it's a democracy. So the thing that is contributing most to the signal is the hydrogen nuclei. So that's why when we speak of protons in MRI, the nuclei that we're talking about is hydrogen. The signal from the other nuclei with odd numbers of protons is very weak and doesn't contribute significantly. So we don't worry about it at all. Okay, so we've discussed the fundamental dancer in nuclear magnetic resonance, which is the hydrogen nuclei, which we will call the proton from here on. So now we introduce a concept which is known as a spin. So as we've already said, the proton is continuously spinning on its own axis. And this spin, the proton is also a particle which obeys the rules of quantum mechanics. So now we're going to introduce a certain word called angular momentum, which is important when we go on to discuss what's known as the Larmor precession frequency, which is really the key to understanding the whole of MRI. So when the proton is spinning, we have this, we're trying to talk about the spin of the proton. So we come up with this term called angular momentum, for which the symbol is L. And the angular momentum tells us two things. It tells us how fast the proton is spinning or how much the proton is spinning. And it also tells us in what direction. So there is a formula for angular momentum here. So M is equal to I h by 2 pi. Here h is Planck's constant. It's just a number. You can think of it that way. It's a number with a lot of significance in the universe, but for our purposes, it's just a number. 2 pi again are numbers, and I is a number which can have different values. So I here can either be 0, it can be a whole number like 1, 2, 3, 4, or it can be a multiple of half. So it can be 1 by 2, 3 by 2, 5 by 2, etc. And the spins of different protons are given by this formula. So different protons can have different spins. And an example of a spin would be if I is equal to 1, then the angular momentum would be h by 2 pi. If I is equal to 1 by half, the angular momentum would be h by 4 pi, and so on. So the protons are spinning. How do we talk about the way that they're spinning? We use angular momentum to talk about that. The next important term is the magnetic dipole moment. And the magnetic dipole moment tells us when you have this proton which is spinning and behaving like a magnet, if you apply an external magnetic field to a magnet, you will see that something interesting happens. The magnet will move within the magnetic field with the intention of getting aligned with the field. So if any of you have ever held two magnets close to each other, you can see this movement happening. When a magnet is brought close to another magnet, the magnets move in order to orient themselves with the field. So the same thing happens in MRI imaging. We have all these tiny magnets in our body, and we're putting an external magnetic field on these magnets. And these magnets are going to move in order to align themselves with the magnetic field. So now we need to discuss what happens when the field is applied. And that is what we talk about using the magnetic dipole moment, for which the symbol is mu. So that's the symbol on the left-hand side of this equation. And mu tells us how quickly a magnet is going to align with the magnetic field. The term on the other side of the equation is L, which we're already familiar with. L is the angular momentum, which is a measure of the spin. And then there's another factor called gamma. And gamma here is the gyromagnetic ratio. So the gyromagnetic ratio is a fundamental property of the type of nucleus, and it's a fixed number. So what we've understood so far is the proton behaves like a magnet. It behaves like a magnet because it's spinning, and how quickly it aligns with an external magnetic field depends on its spin, which is measured using its angular momentum. So our dictionary of terms to discuss the phenomenon of nuclear magnetic resonance is improving. So now we've got all of these terms that tell us how nuclear magnetic resonance works. Now we will keep these concepts in mind, and we'll see what happens during MR imaging. And using these words, we'll understand what's happening. So first, what is included in the MR setup? So there's the magnet, which is going to apply the external magnetic field, the main one. There's radio frequency coils, which do two things. So there's coils which are going to emit these radio frequency pulses. There's also coils which are going to receive these radio frequency pulses. There's magnetic field gradients, and those gradients are useful for things like localization of the signal, identifying where the structures are in the body. There's also the computer system, which is putting all this information together into a meaningful image and sending it to you, the radiologist. So what happens when the examination starts? First of all, the magnet produces a strong static field B naught. So by strong, we mean in the order of around 1.5 Tesla. We measure the magnetic field strength in Tesla. And static. So static means it's not changing. It's a uniform field, the strength of which remains constant. And we represent this field with a symbol. The symbol is B naught. So it'll be good to remember that. Now, when this magnetic field is applied, so first this magnetic field is applied. Next, the radio frequency coils send out a radio frequency pulse. Then after a period of time, the radio frequency coils receive pulses in return. Magnetic field gradients are applied during this process, which localize the signal, and then the computer system converts the signal to the image and carries out other functions like archiving, etc. So let's look at what is happening to these protons during this entire process that we've just described. So if you look at the image on the left-hand side, the green circles with arrows on the left side represent the protons before the field is applied. So initially, the protons in the body, they don't have, so when you're thinking about the angular momentum, you have to picture it as an arrow which is piercing the proton, and the direction of the arrow indicates the direction of the spin. So if the direction of the arrow is, if one arrow is pointing straight up, that means the spin is around that axis. If the arrow is pointing in the opposite direction, that means the spin is in the opposite direction, counterclockwise. So what happens before the field B naught is applied? So the protons in the body are all spinning at random. All their angular momentum arrows are pointing in all directions. And yeah, so there's no net magnetization. We say there's a net magnetization when a lot of spins are pointing in one direction, which is the same. So after the field B naught is applied, which is that thick pink arrow, so the field B naught is applied in the direction which is given by that arrow. And we know that magnetic fields have a direction, which is north to south, south to north, etc. And the direction determines how the magnets interact with the field. Now we see that something very important has happened to these protons. A lot of them have, the pink ones have arrows pointing in the same direction as the magnetic field, and the blue ones have arrows pointing in the opposite direction. So, so what has happened is, because of this external B naught which is applied, the protons have turned themselves around and they've tried to be in the same direction as the field. And some protons are in the exact same direction, and some protons are in the exact opposite direction. So something you need to know about this is that more protons align with the field than against the field. So that's important to note. Okay. So, and this might seem quite strange, because when we're talking about a regular magnet, if you have 1,000 regular magnets like your fridge magnets, which have north and south, and you apply a magnetic field to them, they will all align in the exact same direction. However, we have to remember that these protons are not regular magnets, they are quantum mechanical magnets. So all this means is that instead of there being just one probability of a thing that happens, there are two probabilities of things that can happen. So either they will align with the field or they'll align opposite to the field. And it's like a coin toss. The coin can either be heads or tails, and it depends completely on probability. Similarly, whether the proton aligns with the field or against the field depends on probability. However, the net effect is that more protons align with the field than against it. And what is the reason for that? It's that it actually takes the proton more energy to be aligned against the field than to be aligned with the field. So you can imagine the field as being a very strong river which is flowing along. And the protons have two choices. Either they can go exactly in the same direction as the river, or they can try to swim in the opposite direction. So very easily we know which takes more energy. It's swimming in the opposite direction that takes more energy. So there's a lot of protons which have a certain energy, which is the lower level energy. And then there's a lot of protons which are a step above them, which have a higher energy. And so what will happen if suddenly we press a button and then this direction of the magnetic field flips around in the opposite direction? So the same situation will occur. The protons will realign themselves again. And it's when this realignment happens that something interesting happens. So if you can think about it this way. Yeah, so you can just picture like a waterfall which is moving from top to down. and some people are at the top of the waterfall and some people at the bottom of the waterfall, and the water is flowing in a certain direction. Now, what happens if suddenly the gravity is reversed and the water starts flowing in the opposite direction? A lot of people who are at the top of the waterfall will suddenly go to the bottom, and vice versa, people who are at the bottom will now go to the top. So we know that these states have different energies. So when you reverse the direction of the magnetic field, some protons will lose energy and some protons will gain energy. So that is from just one flip. Imagine that instead of like just having the magnetic field in one direction and then changing it to go in the other direction, you make it go in one direction and the opposite very quickly, like so on off in such a way that the field is oscillating. So what will happen is these protons are continuously being forced to go from one energy to the other by aligning and realigning with the field. So this, so now let's take a look at the equation which is on the screen to try to understand what will happen. So the first term over there is del E, which means the change in energy. Del means the difference, and E stands for the energy of the protons. So what is the difference in energy we're talking about here? We're talking about the energy which is involved for the proton to go from one state to the other. So imagine that in one state, the proton's energy is 10. In the other state, the proton's energy is 5. So the del E in that state, the difference in that state is 5. So every time the field is changing, there's a change in energy which is happening of 5. So that's the del E in that point is equal to h nu. So h here is again Planck's constant. We don't have to worry about constants too much. Instead, we'll talk about the nu there. So nu is the frequency at which the field is flipping back and forth. So how many times is it happening per second? That's the nu that we're talking about. And on the other side of the term, we have 2 mu b naught. So the mu there is the magnetic dipole moment, and the b naught is the external magnetic field. So what this equation is telling us is that all these terms are related. So the frequency which will cause these spins to flip back and forth is related to the external magnetic field which is applied, as well as the mu, which is dependent on the nature of the protons themselves. So this magnetic field, which is flipping back and forth, needs to flip at a certain particular frequency to make the protons change their alignment. And that frequency is related to the external magnetic field which is applied by the equation that we have here. And given that the value of the external magnetic field is known, we know that in MRI examinations, we usually use a magnetic field of a certain strength, 1.5 T. So the frequency that's needed to flip the protons based on this difference in energy is related to the B naught, and practically the number that you get, the frequency is in the radio frequency range. So basically, if you apply a radio frequency field with a certain energy, that will have the same effect as the magnetic field flipping back and forth. So that might be a slightly difficult concept to understand. So all this time we're talking about magnetic fields, and suddenly we're talking about an electromagnetic radiation. So all we have to remember is that the electromagnetic radiation has the same effect as a magnetic field which is oscillating. So so what happens? So we've applied this external magnetic field. There's more low energy protons than high energy protons. When we apply this electromagnetic pulse, that has the same effect as an oscillating field. So the protons experience a net gain in energy due to the distribution of the energies when the flipping happens. In general, there's a gain in energy from the protons. And this is experienced as an absorption of the radiation energy. So when the B naught is 1 T, 1 Tesla, the The frequency nu is 42.6 megahertz, which is in the radio frequency region of electromagnetic radiation. So this is what happens in the first stages of the operation of the MRI. The external magnetic field is applied, the radio frequency pulse is sent, all the protons absorb, energy from the radio frequency pulse, and overall there's an increase in energy that's happened. So in general, we say that the protons are in an excited state. So one thing we know about nature and about almost every natural thing is that we always cycle between periods of excitation and relaxation. So if you have like a really hard shift in the hospital, you're operating in an excited state of energy. And then once you're off your shift and you're back home, and you're watching Netflix or being on your phone, that's your relaxation time. You're coming down from that excited state. So in the exact same way, the protons also lose this energy that they gained when this pulse is applied. And this is called relaxation. And when this relaxation happens, they emit the energy that they gained in the form of radiation, which is also in the radio frequency zone. And by measuring this emitted radiation, we get useful clinical information. So this is the what's happening in the nuclear magnetic resonance in a nutshell. So let's look at a few finer details of what's happening. So you might, if you've seen magnets, if you've played with magnets and applied magnetic fields to magnets, you'll know that the magnets that we can hold in our hands will align exactly along the magnetic field. However, protons are particles ruled by quantum mechanics. So that's why you get these like weird phenomena, like some protons aligning with the field, some protons aligning against the field. Another thing to note here is that the protons, when we say align with the field, they align at an angle to the field. And these are all quantum mechanical phenomena which are happening. And in order to understand why that happens, we'll have to go much deeper into quantum mechanics than is necessary. Yeah, so I'll just show you some videos at this point. So before we come to precession, I'd just like to, if everyone's okay with it, show some YouTube videos as well. So this is a video about resonance, and it's just to help you understand why is it that the frequency of the radiation is really important. So the phenomenon of resonance is when a frequency is applied which matches the internal frequency of a particular thing, and then you get certain aspects which follow. So this is a video, it's not my video, the credit is on the screen here, and it's just showing how when sound is applied to a wine glass, the wine glass will shatter. So I'll just try to play exactly that point. So what's happening here is that a sound wave is being applied to this wine glass. The wine glass vibrates at a great energy. It absorbs energy and it shatters. So this is very similar to what happens with our protons, except that they're not exploding. So this radio frequency pulse is applied to the protons. That frequency is matching something inside the protons, and so a phenomenon called resonance appears, which allows them to absorb energy from the pulse. And they can't absorb this energy from any old pulse. The frequency has to match. And that's exactly what we see in this wine glass here. So the sound wave is applied, causing the wine glass to vibrate. The wine glass absorbs energy from the sound wave. Yeah, and okay, these videos are for later, so I'll go back to the presentation. Okay, so we've discussed, yeah, so essentially that's what we call nuclear magnetic resonance. We call it nuclear because the objects involved are protons, which are present in hydrogen nuclei. We call it magnetic because this is a phenomenon which involves magnetic fields, both static and oscillating. And we call it resonance because when the oscillation of the magnetic field matches, the frequency of oscillation matches an internal frequency of the protons, that's when they are able to absorb energy from the electromagnetic pulse. And that's the basis of this entire phenomenon. So let's keep looking at these videos. So a few finer points of the motion of the magnets in these fields. So remember that we're thinking of these protons as being tiny spinning magnets. And now we understand a concept which is called precession. So if you can watch this gyroscope rotating, now you might not be able to see it too clearly here, but this gyroscope is that yellow circle that you're seeing. The gyroscope is spinning on its own axis, the same way the proton is spinning, and it's being acted on by the gravitational field. And as a result, you can see the top of the gyroscope is not steady. It's not just spinning on its axis, it's also making a rotation that looks like it's wobbling, which, and this type of movement is called precession. So in precession, what happens is the top of the gyroscope, if you could draw out its movement, you'll see that it's describing a circle. And if you join the points on that circle to the bottom of the gyroscope, you'll see that the whole thing makes a cone. And this is exactly what's happening in the proton. So think of that vertical line through the gyroscope as being the angular momentum. So the proton is spinning around the angular momentum, and when it's placed in an external field, the proton also begins to precess. And precession is this wobbling motion that we're seeing here, where the angular direction of the angular momentum is constantly changing and moving along a cone. Yeah, so the movement is identical to a gyroscope. And the way in which this phenomenon, which is called precession, happens, we have a term to describe that, and that is the frequency of precession. So that lets us know how many precessions happen in a second. And this is known as the Larmor frequency. And the Larmor frequency is an aspect of the proton. And the equation which describes it is given there. Mu, that's the frequency of precession, also known as the Larmor frequency, is equal to gamma b naught by 2 pi. So we see that the Larmor frequency depends on the gyromagnetic ratio of the proton. It also depends on the external magnetic field. And this is a very, very significant concept that we need to understand. So this frequency is called the Larmor frequency or the resonant frequency. And here's why this is really crucial. The radio frequency that we need to apply to flip the spins is exactly the same as the Larmor frequency. So this is what we were talking about, where we said the frequency which is applied has to match an internal frequency of the proton for there to be resonance. So the proton has its own internal frequency, which is its frequency of precession in the magnetic field, which depends on the magnetic field applied, as well as the gyromagnetic ratio, which is a property of the proton. And unless the radio frequency pulse that we apply has the same frequency of oscillation, we won't be able to we won't be able to have resonance, and we won't be able to affect the spins of these protons. So this is a really cool way in which both these concepts are being tied together. Okay, so I hope that much is clear. We've essentially talked about Larmor frequency and how that relates to the frequency of the radio frequency pulse, which is applied to the proton. And now we touch on a few more aspects to help us understand our ultimate goal, which is understanding T1, T2, and T2 star, because that's the basis of the images that we see. So another concept that we're talking about here is the magnetization. And magnetization is not looking at individual protons. It's looking at the effect of all the protons as a whole. So let's look at the right-hand side of this image here. We've got a lot of pink things aligned in one direction, a lot of blue things aligned in the opposite direction. So let's see that each pink thing contributes +1 to the magnetization, and each blue thing contributes -1 to the magnetization. So in the chat box, could you please put what would be the magnetization considering all the protons? So I'll just repeat the question. If each pink proton in the image contributes +1 to the magnetization, and each blue thing contributes -1, so please put in the chat box what is the total magnetization. So I'll just wait while you do that. Okay, so I've got the right answer in the chat box there. So it'll be 6 minus 4, which is 2. And so I've got some answers of 2, 1, pink, and positive. So all these answers are, okay, 2 is the correct answer. The magnetization will be +2. And the pink and the positive means that the magnetization is in the direction of the magnetic field. So we've discovered two important aspects of the magnetization. One, it has a value which depends on the individual magnetization of each proton, and it also has a direction. And we'll express that direction with respect to the external magnetic field. So the magnetization measures the net magnetic dipole moment per unit volume. So basically, we're looking at a certain volume of the patient's body, and we're looking at what is the net effect of all the tiny little magnets in that area. So in an external magnetic field, as we've discussed, protons mostly align with the field. So this is a phenomenon which is called nuclear paramagnetism. Paramagnetism means that the magnetization is in alignment with the field. So this is an example of nuclear paramagnetism. Magnetization is a property of the tissue, and the magnetization, so for different types of tissues, you have different types of magnetization, and the amount of magnetization that you'll get is directly proportional to the signal strength that you'll get in return. So if you have high magnetization, you'll get a strong signal, and tissues which don't have a high magnetization will have like a less strong signal, and this will be like an aspect which helps us get contrast between different types of tissues. So let's look at what are the features that depend on the signal strength. So the signal strength depends on the magnetic field which is applied, and it also depends on the Larmor frequency of the protons, which again depends on the B naught. So ultimately, the signal strength is proportional to the B naught square. So when you're trying to figure out how strong will be the signal that I'll get, you will be thinking, how strong of a magnetic field should I apply? So it's directly proportional to the square of the external magnetic field. The signal also depends on the proton density within the tissue that we're examining. I hope that's clear. So a little note, we've been focusing on the protons in the nuclei until now, and we talked about why we're looking at hydrogen nuclei versus other types of nuclei. So you may ask, we know that these atoms have other particles in them, and that's neutrons and electrons. So neutrons were completely throwing out of the equation because they don't have charge, so they don't interact with magnetic fields. However, there are electrons present in these atoms as well, and the electrons have the exact same charge as the proton. So we should ask the question of, why is it that the electrons aren't affecting the signal that we're getting, the nuclear magnetic resonance signal? So there's a lot of reasons. So the electrons behave as magnets too, and there's two configurations in which they appear. One is in which all the electrons appear as pairs. So we've already seen that the when the protons appear as pairs, they don't contribute to the NMR signal. Similarly, when the electrons appear as pairs, there's a thing called diamagnetism which happens, which is where they act as dipoles. There's also unpaired electrons present in the atoms, which is exactly what it sounds like. They don't have a pair, in which case paramagnetism can happen, where they align along, they behave like magnets, aligning with the magnetic field. However, they don't affect the magnetic resonance signal because they have a completely different frequency, and their signals are lying in a different electromagnetic region, the microwave region. So it's like we have our signal receiver is speaking only English. So it's only going to be listening to the people that speak English, whereas the electrons are speaking a completely different language. So that's why they don't contribute to the signal, because their frequency of signal lies in a different frequency, which is the microwave region. Yeah. Okay, so we've got an understanding of what is the nuclear magnetic resonance, and from this we need to understand how do we give rise to the T1, T2, and the T2 star. However, it's nearly the end of the webinar at this point. So I don't know if I have time to go through my remaining slides. I've got another, 10 slides or so remaining. Is everyone okay with it going slightly over time? If you could just put a yes in the chat box. Otherwise, we can stop here for today and we can continue discussing these topics in the next session. Okay, so I'm getting some yeses in the chat box. All right, so I will continue discussing the topic. We might go slightly over time. If you need to leave the webinar, the recording will be available on the revised radiology dashboard. Okay, so we've looked at what is producing the signal. We know that the magnetic field is applied, then the radio frequency pulse is applied, then resonance happens, then the protons will emit another radio frequency signal. Now we need to understand, okay, so we have this radio frequency signal. What does this actually tell us about the tissues that we're looking at? And now we come to the nitty-gritties of measuring the signal. And there's two important terms that we discuss here. So one is the longitudinal magnetization, and the other is the transverse magnetization. So we know that magnetization is the overall magnetic effect of all the protons. Now, these terms, longitudinal and transverse, are referring to the direction of the overall magnetization. So longitudinal magnetization is the amount of magnetization in the direction of B naught, which is a strong static external magnetic field, which is applied in the beginning. And in the equilibrium condition is what happens when the external magnetic field is applied. So it's like there's people. So just imagine you have like an ice cube tray, and all the ice cubes are lying in it scattered. You give the tray, a shake, you position it in a certain way. That's the external field that's applied. Now all the ice cubes fall into their slots and they've found their positions. That's the equilibrium condition. So in this state, the longitudinal magnetization is 100% in the equilibrium condition. So what this means is we add up all the spins the same way we did on that previous slide, and we say, okay, all the total magnetization, all of it's pointing in the same direction as the external magnetic field. However, there's a problem here. And the problem is that we're not able to measure the longitudinal magnetization directly. And the reason for this is very simple. So the external magnetic field that we've applied has a strength of 1.5 Kessler. That's a really strong field. And conversely, the magnetization we're talking about is at the level of a proton. So you have a tiny, tiny, tiny magnet. There's absolutely no chance that you can measure the magnetic signal in the same direction as the B naught, because it's like if you have somebody shouting very loudly and you're trying to hear somebody whispering at the same time. All you will hear is the person who's shouting. So we need another way to measure this magnetization. So how do we measure this magnetization? Because this magnetization is what tells us things about what kind of tissue is it, and that's the information that we need. So first we recognize that very conveniently for us, we can treat the magnetization as a whole as a single magnet which has a spin. So we know exactly how to deal with a spinning magnet. We have a vocabulary that we've already discussed to deal with this. So what we're going to do is we're going to change this longitudinal magnetization to another direction. So the problem is the field in one direction is very strong, so we can't measure the magnetization in that direction. So the answer is simple. We change the direction of the magnetization to another direction in which we can measure. And this direction is the transverse plane. And the transverse plane just means the plane which is at 90 degrees. So if you have your magnetization in this direction, the entire area which is perpendicular or at 90 degrees to that is known as a transverse plane. So our objective now is we need to, this magnetization that we're thinking of as a spinning magnet, we need to force this spin to tip over so that we can measure it. So how do we do that? We have the answers already. We know that applying a field causes the alignment to change. So what we do is we just apply a magnetic field B1 in the transverse plane, in the direction that we want the magnet to change to. So now what we need to do, so what happens is you have this magnet which is spinning in one direction. It's already being acted on by a field and it's precessing as well. So you have to remember that precessing motion. Now what happens is when you apply a field in the perpendicular direction, that field is going to pull the magnet. If you remember that gyroscope in your mind, that line which passes through it, that gyroscope line is going to describe a spiral down, 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 and until it's fully spinning in the perpendicular plane. So that's what we expect will happen. So once again, in order to tip the field over, we have to use the right frequency. And this field as well, the oscillating field must have a frequency equal to the Larmor frequency. And we know that means a radio frequency. So what are we talking about here? We're applying a radio frequency pulse, which is in the 90 degrees direction. And this 90-degree radio frequency pulse causes the magnetization to reorient itself towards the 90-degree direction. And I have a video to show this as well. So if you think about a spinning top, the external magnetic field in this case is the gravitational pull. However, the spinning top also experiences a 90-degree force, which is the frictional force. So we can see exactly what this will look like in this video that I have here. So if you just watch these tops on the screen, I hope I'm sharing the right screen. But yeah, you can see that they're spinning, they're precessing as well. And they're acted on by the gravitational force. They're also acted on by a frictional force, which is in 90 degrees to the gravitational force. So what happens is the top line, which is through the tops, keeps on moving down, down, down in a spiral motion. Here, of course, it doesn't go completely 90 degrees, but in the case of our protons, that's what happens here. All right. So this is the motion that I'm talking about that I was trying to show you in that video. So the angular momentum, the magnetization, sorry, follows this spiral path. Once it's pulled by this pulse that we're applying, it precesses at a new angle. This angle keeps changing until finally it's completely flat. And then it'll be precessing in the 90-degree plane. Okay, so and this process is called excitation. So after this radio frequency pulse, the longitudinal magnetization is 0%. The transverse magnetization is 100%. And so this magnetization we're imagining to be a giant magnet, which is a combined effect of all the spins. And all the little spins which make up this giant magnet are spinning at exactly the same time. So we say that they're spinning in phase. And next, the thing that we're looking at to understand T1, T2, T2 star is what happens post-excitation. So I have one more video for this. Okay. Recording continues. Now we are moving to the relaxation processes, which come after the excitation processes. And these depend on two things: the interaction of these magnets with each other and the interaction of the magnets with the lattice in which they're embedded, that is the molecules around them. So if none of these videos belong to me, by the way, they all belong to other people who put them up. So if you just watch these magnets, you will see that all these different magnets are interacting with each other, and because they create magnetic fields as well. So the magnetic fields created by each magnet causes the magnetization of the other surrounding magnets to change. And this is one of the processes which causes it's one of the post-excitation processes and one of the features of the relaxation. So what's happening here? Initially, after this 90-degree pulse is applied, all the magnets are spinning in phase together, but they're also creating their own little fields. And these fields will interact with each other. And what will happen is the spins begin to dephase. That is, if you picture them, if you picture their angular momentum as being an arrow pointing in one direction. Originally, all the arrows are in the same direction, but as I'll just mute the person who's speaking. Yeah. So as the fields interact with each other, all these like angular momentum, which are initially in the same direction, will split apart and they'll look like what we see in the video here. So now what happens is that they are contributing different amounts to the transverse magnetization. Initially, when we're calculating the transverse magnetization, we just count +1, +1, +1, +1. Okay, that's magnetization. Now, as these spins begin to break apart, they start contributing different values. Some start contributing +0.5. Some even start contributing negative values, -0.5, -0.3, depending on how much they've been dephased. So this causes the transverse magnetization to decrease. So initially you have +1, +1, +1, +1. Now you have +1, +1, -0.2, 0.5, -0.6. So the total is decreasing. And eventually what happens is that the net transverse magnetization is 0. So this is one of the relaxation processes. And the other relaxation process is that through interactions with the molecular lattice, the transverse magnetization is lost as well. And the longitudinal magnetization goes back to 100%. So this has been a brief look at what is nuclear magnetic resonance and what is the excitation that's happening and what are the relaxation processes that give rise to our relaxation types, which is T1, T2, T star.